We are joined by Judy Corbett, MD, who is the owner and medical director of Baldwin GYN and Aesthetics. Dr. Corbett is originally from Birmingham, Alabama, where she also received her BSN and MD. After residency, she moved with her family to Bay Minette, Alabama to establish a practice. Dr. Corbett has practiced OBGYN on the Gulf Coast region since 1996 and has enjoyed becoming active in many aspects of the Mobile and Baldwin County communities. Women's healthcare is a true passion of hers, and she seeks opportunities to promote and impact women of all ages through her expertise and services. During the last 6 months, she has been expanding her practice rapidly, integrating a number of new technologies and treatments for her patients' overall skin health. We're also joined by Wendy Lewis, the founder and president of Wendy Lewis & Co. Limited Global Aesthetics Consultancy, which she has been running since 1997 as a boutique communications agency in New York City. Wendy is an award-winning writer. She was the recipient of the 2017 Johnson & Johnson Award for Best Beauty Trade Journalist. She's the author of 13 consumer beauty and health books, including America's Cosmetic Doctors and Dentists and Plastic Makes Perfect. She's the founder and editor-in-chief of beautyinthebag.com since 2008. A prolific writer for consumer publications and trade journals, she is on the editorial board of Prime International Anti-Aging Journal, a contributor to Aesthetic Society News, Practical Dermatology, Modern Aesthetics, Aesthetic Medical Practitioner, HealthNewsDigest.com, and many other publications and websites in the US and abroad. So from here on out, I'm going to let the two of you take over the presentation, and we will see you at the end.
Thank you, Sean. You've left two women in charge, a smart move. So it's really a pleasure to be here with the Aralace team, and it's so lovely to meet Dr. Corbett, who has a really thriving practice, and we'll talk about a little bit about how she got started in aesthetics, because her story is very interesting. So here we are, it's now October. What have we learned during this year in medical aesthetics? Well, I think there's a lot of good news because we've learned a lot about patients, and one thing is for sure, patients really missed you. They really wanted their aesthetic services, and that's not going away. The desire is still there. Medical aesthetic patients need continual treatment. That's especially true with almost anything that you do in an aesthetic practice. It's not really a one-off. Maybe a facelift in a plastic surgery practice, maybe a one-off, or maybe it isn't, because that patient, there's a continuum of treatments that you can offer that patient by bringing them back. And they're more selective with their spending. That's no question, because I mean, everybody's kind of in a different financial circumstance, but they will still make time and find money to have things done that are effective, that work for them, and that really deliver results. And I think that's the key here. They probably aren't going to spend as much money on things that are kind of like, you know, you have to look in the mirror to figure out, did something really happen? But results-oriented treatments are always going to be popular. And COVID has really changed the way everyone practices. It's also changed the consumer mindset a little bit. But I think we're in a much more positive state right now. I mean, I'm from New York, and New York was shut down for 3 months. You know, we don't think about that anymore. And the doctors that I'm talking to are really, you know, doing much better, and they've adjusted to all the things that COVID has changed for us. But COVID has also opened up a few other doors. So patients have needed to come back to your office, not only for aesthetic treatments, but medical services as well, right? They want to receive their toxins, their fillers, facial treatments, but they're also very concerned about their acne, especially maskne, which is a real thing, rosacea, melasma, and many other things. And skincare regimens have become, I think, an integral part of many aesthetic practices, as they should be, because it's a natural dovetailing effect. There are even COVID-related skin issues that have absolutely soared in the past few months, from patients who may not even have seen your practice yet, and you have the opportunity to capitalize on that group of patients. But they are seeking solutions, especially for acne, definitely for facial redness, rosacea, and pigmentation is always going to be high on that list, and I think that skews all skin types. And also think about what people have been doing. They've been hibernating. They're probably not as healthy or feeling as healthy as they have because they haven't had as much vitamin D or been able to exercise as well outdoors. So they need kind of a fix, and they need someone to help them get their skin back on track where they really want to be. What we really want to get to tonight, which is action plays to get back your patients and profits. And with all of this being said, and having learned a lot from Dr. Corbett as to how she approaches medical treatments and can bring those patients into her practice for aesthetics, we want you to think about your business operations as they are right now, and try to be open to considering some new strategies that can actually really help you now and going forward. This is an important time of year. Historically, this is one of the best, if not the best, times of year for aesthetic treatments when you think of the holiday season coming up. And I think people really want to treat themselves right now because, God, 2020 has not been fun, no matter where you live. So be open to considering some of the strategies we're going to address right now, tweaks, make some additions to your practice, what's missing, what are patients asking for that you don't have solutions for, because that's the way to lose a patient. They're going to go somewhere else and you may not get them back. And hopefully all of these tips will help you generate more revenue and increase your fees per patient, which is critically important. If your capacity is lower, then you know you're not seeing as many patients and you want to make the most of every visit. Aside from the fact that not every patient wants to come in every month or every 6 weeks, and you can have options for them where they stay with you between home care visits and skincare consults, virtual consults, to stay connected to that patient so you don't lose them. So let's talk play one. Let's evaluate the services you offer now. So look at your service menu. What are your most popular procedures? And if you don't know this, it's a great time to find out because we're coming to end of year. So looking at your practice much more objectively will also help you plan for 2021. And let's pray that 2021 is not going to be like 2020 and is going to start off with a bang in a good way. What's the most popular? What are patients asking for? What are your biggest money-making procedures? Meaning, where's your biggest profit coming into your practice? And that's going to vary between what type of practice you have, how many patients, and obviously geography. And are those services that were really popular in 2019 and early 2020, are they still the best treatments to offer at this moment in time, in this climate? Are you going to need to add services? What are people asking for that is a lucrative treatment that you're not offering? Because if you don't have it, they're going to go down the block to the next person. Another thing I find a lot with practices is that they may have lasers or devices that are sitting there gathering dust, right? They're like expensive coat hangers, and patients aren't asking for them. So don't go out and buy a device that patients aren't really in line, like something they really need, and then go look for patients to use that device on. You need devices that actually treat a lot of conditions that fit into your practice, both they're affordable to operate, and also as a New Yorker, I always look at the size of devices. So it's got to fit in your practice without having to move doors or bring in a piano mover. Next, are you missing out on any revenue streams? For example, if you're not selling skincare in an aesthetic practice, that's a definite one to look into. There are lots of good brands on the market. And patients want that, and that's something you can make money on while you sleep because you can sell it online. A lot of skincare brands today will allow practitioners to sell through their own website and still get a commission. So definitely want to look into that category. And have you diversified your revenue streams? Or are you kind of stuck in one area, not wide range enough to treat a new group of patients that are in your community? These are questions to ask yourself. So I'm going to now go to some very interesting results and ask Dr. Corbett to walk us through what treatment and how this has been done and how this has affected this patient with a very nice result from the Airlace team. So if you have this patient come into your office, Dr. Corbett, what type of treatment would you recommend for her? And where do you think you'd stand with a patient like this? How many times would you have her come back? Give us some general ideas of how you might treat this patient. And I think this result is excellent.
And I think this first one is acne. Yeah, there we are. Oh, go back again.
Yep. Sorry. Right after, that's it. You got it.
This is a typical female, but that can certainly affect not just women, but men, and not just young people, but even older individuals struggle with acne-related problems with their skin. This is a patient who's probably going to already maybe have been on antibiotics, maybe they've been on spironolactone, maybe birth control, may even have had been told about Accutane and some of these other medical regimens. But Airlace has really changed the treatment results and the treatment options for people struggling with acne. And so a lot of the women who come in my office and are struggling with acne, I tell them that there's medical things we can do, but you know what? There's aesthetic things that we can do for this acne as well. And so this would be a perfect candidate for something that I call Acne Be Gone. We're going to talk a lot about bundling. And so what we've done is we've combined Airlace, which is a 1064 laser that not only treats acne, reduces recurrence of the acne lesions themselves, reduces the bacteria, helps reduce the size of the pores, but it also helps correct that underlying scarring that occurs. And so we have put together a bundle of 3 acne treatments. Those are usually anywhere from maybe 2 weeks apart to as much as 4 weeks apart, depending on the individual. We combine that with our esthetician who will either do extractions or an acne facial to go along with those laser treatments. Oftentimes we'll add a chemical peel to that, and then certainly talk to them about some skin care, what they're using to clean their skin with. Are they exfoliating? What kind of moisturizer are they using? And so we bundle all that together and call it an Acne Be Gone package. It's very affordable. We charge $650 for the 3 treatments, 1 chemical peel, and a starter kit with the acne medication. But obviously pricing would be dependent on the area that you're in. But it's a great option for these people who've done a lot of things already for their acne. They're not happy with that. And as you can see, the results from the laser therapy just by itself, that's what this picture is. Remarkable reduction in lesions, size of lesions, redness, and also a lot of the scarring that is seen with acne.
Yeah, I'm sure she's very happy. And I mean, I like the way you're treating this, like as a multifactorial episode for the patient. You're giving them lots of options, which I think is smart because, you know, if it's a new patient, you may not know what's their tolerance for a treatment, how often are they going to be able to come back, and what's their budget. So you're offering them kind of a round of treatments that they can choose, and then you can kind of dissect it and do something very customized, which I also think is something patients really want now. I think they need a little attention because they've kind of been left alone for so long now, and people are very vulnerable. I think that's part of sort of the post-COVID movement. Let's move on to rosacea. Here's another very nice result. And
So
I mean, rosacea's on fire.
Absolutely. And
yeah.
You know, those individuals struggling with rosacea are very frustrated. There's not really anything out there that does a great job for rosacea. It is a chronic problem. And so having a very honest conversation with your patient, with your client, is always very important. Airlace brings a few things to the treatment table that I have found super, super exciting. First and foremost, as a 1064 laser, it targets not only hemoglobin, but it also targets water, and it targets pigment, melanin. Rosacea is not just vascular in nature, it's actually inflammatory in nature. And so you get a significant correction of that underlying inflammation, and also correction of that underlying pigment or melanin deposition that sometimes causes that rosacea to be so persistent or chronic in nature. Most of the people that I see need anywhere from 4 to 6 treatments with rosacea. I would guess that this individual, to get a complete resolution, would be looking at probably 4 treatments. Those are usually spaced out about 3 to 4 weeks each treatment. Again, we'll talk more later about how to bundle and how to put these packages together. This is a great example of why I don't like to sell a treatment, because her first treatment will be quite aggressive. She'll be a little tender. She may even have some redness. But then with each treatment, as she sees improvement in the condition, there's also, less impact from that treatment. And so you really want to make sure that it's not about selling more service or more treatment. It's about selling results. And so you want to make sure that you prepare them for what's going to give them those results.
Right.
And this person would need probably about 4 months of therapy.
Plus, I think that once you treat a patient like this who has a medical need and is really, really upset with what she sees, you gain her trust. And then when it comes to maybe looking at other treatments, they may be more open to it because you've already demonstrated that you know what you're doing. And oh my God, this doctor really helped me. What else can you do for me?
This lady, I would also point out, this was a treatment. I didn't do this treatment, but this was a treatment for rosacea, meaning the cheeks area was treated. But if you'll notice, a significant reduction in her pigment in that area that was treated. And, so I would also ask her, hey, you've got some little pigment lesions and some little angiomas on your neck. We could also laser those. You always want to look at the whole picture. You don't want to just treat the rosacea.
That's such a good point. And can I ask you I'm going to throw this out there because it's such an important topic later. We'll get onto it a little more. Would you see this patient in a virtual consult first? Do you do those in your office now?
I have the ability to. It's not something I've done a lot of, only because where we are, we're not shut down for that long of a period of time. So we have the ability for them to come in.
Understood.
Absolutely. I absolutely, could, do a telemedicine visit, talk about a treatment plan, and then, get them in and do that. So depending on where you are and how reluctant people may be to have multiple visits.
Absolutely. I think that's such a good option, and it's really kind of baked in the cake right now. So many practices are offering it. And I think it's a benefit to the practice as well as the patient. Not everybody wants to come to a doctor's office right now. Some of them want to find out first what the options are, and then they'll come in when they're ready, which is pretty fine. So let's go to the next slide, please. And we'll look at this very nice result from ingrown hairs and hyperpigmentation.
So there's 2 things I want to make sure that I share about this particular slide. Yes. So again, we're looking at results with Aerolase Neo Elite 1064 laser. We are treating the ingrown hairs, which we know are bacteria laden. So you get reduction in the bacteria, you get reduction in the pore size, you get decrease in the pigment, dark pigment changes, and oftentimes scarring. This individual doesn't have terrible scarring, but when there is some scarring there, it certainly is very effective. You are going to see hair reduction when you treat with Aerolase, because one of its 30 indications is hair reduction. Most men, surprisingly, don't have a problem with that, but you want to make sure if you're in an area, maybe the upper lip or an area that they're going to be concerned about facial hair, you need to have that conversation. But the results are phenomenal. For whatever reason, the individual that struggles with these ingrown hairs, whether it's of the neck, we see a lot in the axilla, and we see a lot in the groin and vulvar area.
Yeah.
And in those areas, combining that ingrown hair treatment or follicular pseudobulbi treatment with hair removal, so you add those 2 packages together, you get tremendous results and a much longer result from these ingrown hairs. The second thing I wanted to comment on is You will hear us refer to Airlace as kind of a laser for skin of color. If you are familiar with many of the lasers on the market today, you have to be very cautious with skin type. Those people with types 4 through 6 can get rebound hyperpigmentation and scarring from the laser, and so you've created more problems than you treated. And we don't see that with Airlace, and that's another whole conversation. But you can safely offer this individual with darker skin tone an option for both their hair, but also for the ingrown hairs and hyperpigmentation without creating more rebound hyperpigmentation or scarring.
So I'm going to turn the next slide over to the lovely Dr. Corbett to talk about her experience in bundling and subscriptions. And I know you talked about some of the different things that you're doing with various treatments. So tell us how you're handling bundling packages in your practice. I know you said maybe subscriptions wasn't the quite right term for what you do, but
Right.
let's tell our audience what's worked for you and what do you plan on doing more of now?
Absolutely. And I do want to add a point to your last slide, and you may address it later on in the webinar. But in looking at your services, really, I think now is a great time to look at what you're doing from a marketing standpoint, and even more importantly, is it time to assess your brand? Have you branded yourself? That's something that I did about 2 years ago, and it was painful, but it has absolutely paid back in dividends. Really identifying what it is you offer and why you are either a leader or a specialist in that, whether it's medical skincare or whether it's skin rejuvenation or hair rejuvenation, whatever. Really kind of look and see, do I have a brand that exists? And looking at product, another thing I think that has really been a positive for me is there are companies out there that you can co-brand skincare with, so that you can put your name or your label or your logo on those products. So they can't just get it at Amazon, or they can't just get it somewhere else. Just something to think about.
Sure.
When it comes to bundling, or I kind of think of it as maximizing the treatment. Aesthetics really is no different than any other medical platform or scenario. As a gynecologist, I'm obviously very medical based, very treatment oriented, and so aesthetics kind of fits that perfectly. If someone is concerned about rosacea, ask them, if there are other things that bother them as well. Point out you have these pigment areas, or I noticed that you have some scarring. I mean, look at the whole picture. Maybe they do need Airlace for rosacea, but maybe they also need skin tightening, or maybe they also need, Botox to take care of, those lines and wrinkles that we get with movement and unfortunately aging. And so always try to be thinking about the whole picture. We put things together. I already mentioned the Acne Be Gone package. We really do try to kind of put together packages so that people, if they get Botox and a laser treatment and maybe a chemical peel, then we'll bundle that and adjust the pricing so that the patient feels like they're getting more for their service. And so you really kind of just look and see where are areas that I could upsell or add another service to what we're doing. Maybe, modify that second service so that it's cost effective for the individual. But then they're going to start coming back to you for more and more things. And so I think really
that's a great point.
Those bundles, you want to keep them coming in the door. So, VIP patients are very important. Have something that patients can participate in, whether it's a loyalty program, so that they're getting points when they spend money, and then you can reward them, with their birthday or other, occasions. Do you have the ability to put together membership packages so that if you're coming in monthly for, facials or dermaplane or skincare or whatever, then they get a discounted rate on their Botox, and they get a percentage off of laser therapy. They're much more likely to ask about them if they feel like they're kind of getting something for being, a VIP or being part of the practice. So I think anything you can do to really try to tie all of your services together is going to be key.
I agree completely. I mean, think of how you yourself as individuals treat shopping, just buying into any kind of consumer demand. What do? I mean, loyalty programs mean a lot. Memberships make a difference. And I feel like these offers will keep patients in your practice longer than if you didn't offer them. There's a reason for them to come back. Series pricing for any repetitive treatment, very important. Also think about the patient's already in the chair, right? So doing another treatment on that patient while they're already in the chair, you've already spent your marketing dollars to get that patient in the door.
Yeah.
So the goal is to treat the patient and offer them more than one treatment. If they don't want it, that's fine too, but at least bring it up, introduce them to other things in your practice. I think one mistake that a lot of practices make that I see is giving them an extra something of the thing that they're already doing. Instead of doing that, I would advise you don't have to throw the baby out with the bathwater, but introduce them to something else in your practice that they don't know about. They already like treatment one, like let's say it's laser hair removal for the moment, but maybe they've never had some kind of a photofacial or a smaller treatment just for specific condition like the rosacea patient we saw a little earlier. Then you're introducing them to something else you offer and giving them another reason to come back. So on that note, let's talk slightly, because we've already dealt with bundles and packagings, I think. Let's talk about reviewing your treatment fees. So pricing strategies are all across the board, correct? And a lot of it has to do with the type of practice you run, the geographic and demographic of patients that you're dealing with, and literally what the market will bear. For example, a lot of markets, to choose charge a consultation fee will leave you with an empty waiting room today. So Dr. Corbett, how do you handle your pricing strategy? I know you talked a lot about packages, but I mean, in your market, what kind of pushback do you get and how do you overcome that?
That's a great question. And two things, and there are as many different ways to do this as there probably are, the fish in the sea. And so it really does matter what works for you. And so I would probably recommend, if you don't know what your competition is doing, you probably should.
Yes.
Not just how much they're charging for hair removal, but do they charge for consultations? Do they have other services? So we have found that free consultations get them in the door. And so we do a lot of free consultations. In fact, almost all consultations are free. And I do feel like they get in the door. And if they're not interested in spending, $2,000 or $3,000 on hair removal head to toe, you get the chance to say, well, we also have something that could treat your acne or something that could treat, other areas. And so sometimes they're coming in for a consult about one thing and you end up actually talking to them about something else and selling something totally different. Getting them in the door is important. I like the idea of virtual consults, especially for known clientele. Not so much maybe for the new patient that hasn't been in your facility and met your staff, but definitely
also for follow-ups.
Absolutely, I love that idea, and we're going to absolutely look and see if we can't add that to what we're doing. Definitely, you want to be competitive. You don't want to be the low man on the totem pole, and you don't want to be unrealistic in your pricing.
Yep.
I've kind
Yeah,
of
that's a
learned.
bad strategy. I agree. I mean, if you start discounting, you will get labeled as the discount practice, and you
Correct.
never want to go there, because if you become the discount practice, you can never go higher.
No,
You've already established yourself that people are, it's the Groupon synonymous, the Groupon phenomenon that was a disaster for aesthetic practices. Please don't do Groupon or anything like that, because that pigeonholes you into a category. You're never able to raise your fees. You can always lower them, but raising them is much, much harder, and you will lose patients in the process. So, be careful about that. In some markets, a consultation fee is just a non-starter. They're not going to come. That's why in many markets, you're able to do a 20-minute, 15-minute, if you want, virtual consultation at no charge, 30 minutes if it's something bigger, and you can determine that at the time. I think that could be a good use of your time if you've got a really busy practice, and then you kind of assess the patient and have a better sense whether they should come in for a live consult and what they might be interested in. So we talked about bundles and packages, I think, and if anyone has any questions, please use the chat box on your screen and we'd be happy to answer them. So let's move on to the next slide about distributing risk versus non-invasive and aesthetic and medical treatment mix. And I think that Dr. Corbett kind of addressed this a little bit, but how do you use this in your practice? Like your skincare, is it the last thing you talk about? Is it the first thing you talk about? How do you bring these things up with patients and determine at the outset, what do you think this patient is going to do best with to save some time?
That is a great question. And two things. One, it's a little off script, but you really, from that very first slide, things to kind of maybe go back and look at and assess and do inventory of. You really need to take an inventory of your staff. Is your staff engaged? Because more times than not, I've gotten wrapped up in the consultation and I'm talking about treating the rosacea and maybe some other things, or maybe they're here for a medical problem, hormones or something. And, I may not get an opportunity or get to talking about our skincare line. But the young lady who checks her out and schedules her appointment to follow up in 2 weeks and come back in for her lasers, like, oh, and have you tried our vitamin C serum or hyaluronic acid, or I've been using this pigment eraser. So engage your staff. Yeah. Your staff can do more for filling in those gaps. Make sure they know, are you having a special? If that lady is checking out and she's coming back in for some skin rejuvenation, let me give you some information. We're having a Botox day in 2 weeks. We'd love for you to know about it. So some of it is taking opportunity throughout the whole visit. It's not all just on the practitioner. Does that make sense?
Oh, I agree completely. I mean, the staff is essential, and I think you have to have regular staff meetings. I know how hard that is in a busy practice.
If you're going to make it in aesthetics, you have to, and
you have to be on the same page. It's really important. And I think that I've always believed that anything new in the practice, everybody's got to be onboarded. I personally like to have the entire staff be able to experience the new treatments that you're bringing in, because then they can speak from authority to the patient. Oh, I had it done and it doesn't hurt, or I had it done and look at my great results and how happy I am about this. It's much more authentic, right?
Absolutely. Especially a laser treatment or a, minor or invasive treatment. If the staff does not know the results and the experience, they just cannot share it.
And they can't sell it either, right? And the patient is going to ask, oh, did you have it done? Right?
Absolutely.
And if you say no, it's okay, why not?
I've got a little girl that's sitting on my front desk, and she's got before and afters of her very dark pigment lesions that she did everything she could do to hide, makeup and all kinds of stuff. And we've treated her with Airlace and some skincare products and some chemical peels, and the results are unbelievable. And she is all day long looking at her phone. Oh, I see you've got a pigment area. let me show you mine. And so engaging them is important. And there's a lot of things that you can do to do that. And then,
I think that's very true. So let's go on to forecasting revenue, which I think is always difficult, especially in the era of what I like to call post-COVID, but we're clearly not out of it completely. So, and I'm not an accountant, I say that right up front. However, I do think that many practices that I talk to really don't have a handle on what their profits are or what their profits aren't. I think sometimes if you really don't have this buttoned up, you may think you're making more money on treatment A and you're actually making the most money on treatment C. So this is important for you to know because it factors into your entire marketing strategy. And it also helps you know what to bundle. You're going to bundle something that really doesn't have a lot of cost for the practice. You may throw something in or discount it because you're not paying a lot for it. So I'd love to hear, Dr. Corbett, how are you doing this? And I mean, you're relatively new in aesthetic practice, and I'm so impressed, like you have got this down. So you're a great person to ask this of because you've kind of learned it on the fly. How do you determine how to forecast your revenue? And if it isn't you who do it, is it the practice manager or a business manager? How is that set up?
I personally, being a solo practitioner, obviously I'm the one that has to do that. A larger multi specialty practice or several physicians in a practice, you might delegate that to someone else. But you need to know at least twice a year, what your actual costs are. And there's an unpopular word in the laser sales market called consumable. And it's real easy to forget what the consumable is for XYZ. You've got some, devices that you have no consumable on. You have others that, it maybe cost you $200 every time you turn that machine on. So knowing what your consumables are, how much does it cost your staff to do it? Does it take them an hour to do it? Does it take them 20 minutes to do it? Are there other, costs involved, supplies or whatever? So really having a feel for what it costs you to do a procedure. And then, like you said, don't bundle two expensive services together unless you're really going to be able to increase that price point.
Yeah, I agree completely.
Again, Airlace is such a perfect fit for my practice because it is basically a non-consumable item. So that thing does not turn off all day long. Somebody comes in for Botox and we're kind of laughing and she's like, I hate my hands look so old. And I'm like, we can do skin rejuvenation of the hands with Airlace. And I noticed a couple of little spots there. Why don't you let Nikki just treat you real quick, take 5 minutes. Doesn't cost me anything, maybe 5 minutes of my text time. And she books, a hand treatment when she leaves. So, knowing those devices that you can do that with.
Right. That makes a lot of sense. And we used to have sorry, please go ahead. We used to have an expression that I never use ever called loss leader. I don't like this concept of a loss leader. That's kind of the Groupon philosophy. It's like a loss leader, like, yeah, I'm not going to make any money on it, or I'm going to lose money on it, but I'll make it up in the end. There's no reason not to make money on something, and there's no reason to lose money on something. I think that's an antiquated way of thinking. If you're not making money on it, or you're in fact losing money, meaning that you're paying for a consumable and you're not getting enough for the treatment, or time is money too. Your time is valuable, and you have to consider how much you need to make an hour for you to be content at the end of the day, and especially at the end of the year. And your staff's time is definitely valuable. And just the real estate, especially in a post-COVID era, you see less patients because you spend more time with each patient. You've got to sanitize the room. There are all these other considerations. Now is the time to dump things that don't make money or lose you money. I think this is a perfect, it's like should be the New Year's resolution for every aesthetic practice. Like that's just a bad strategy. don't go there. And it's not necessary anymore. There are enough treatments on the market to choose from that you can actually really do well with. We're going to have to hurry up because we've talked everyone's ear off, you and I, Dr. Corbett. So let's go to the next slide, please. Trading up for something new. And I'm going to let Dr. Corbett talk about this for the moment. And I believe that this is more referring to, is there technology in your practice that's kind of a coat hanger, right? Or you find a lot on eBay, and how you can trade up to improve, obviously, your ROI by bringing in a different piece of equipment or a different product entirely, and sort of getting rid of the old and bringing something new and fresh that patients are actually asking for. Has that been part of your practice? Has that come up for you?
Absolutely. This is definitely something that at least we are seeing, and how much of it is just 2020 in general, and how much of it has been COVID generated, and how much of it is just that our aesthetic clientele are changing. And what I mean by that is the age is dropping. Younger and younger people are seeking aesthetic services for preventative to avoid some of the aging issues that we see in our aged population.
Mm-hmm.
And the other thing that has just absolutely exploded is that the technology now is leaps and bounds better. Patients don't want invasive procedures anymore. They don't want a facelift. They want something else done for loss of collagen and lines and wrinkles and, you know, laxity to the skin. And so the technology has just absolutely, it's unbelievable. It changes every single day. But also, you know, the tolerability of the service has changed. Maybe you have a CO2 laser, and maybe you do, you know, resurfacing or skin rejuvenation with that. But it's very painful. It has a significant recovery. Your skin looks like a pizza grater for, you know, several days, if not longer. And now we have devices out there that the patient can come in. They don't need to be numbed. It is not painful. It's actually sometimes even tolerable or pleasant. They have no downtime. They can leave here, put on some sunscreen and a big hat and go to the beach, because I live in a coastal area. And so if you're not getting some of these newer devices, even though you might do skin rejuvenation, you're not going to be able to maintain your clientele.
Yeah, great. Can we have the next slide, please? So I don't want you not to have an opportunity to talk about your experience with Airlace. So please add anything you'd like to say that we haven't already covered, and then we'll move on.
There are a couple of things, and everyone can read this slide for themselves. Obviously, I've actually hit, I think, on almost all the points on this slide, that it does target pigment, it targets hemoglobin, it targets water, and so it treats both the epidermis and the dermis. It has 650 microsecond technology, and I'm not a laser specialist by any means. But that means that it doesn't hurt, it doesn't scar, it doesn't hyperpigment, and you get great results in that phenomenal science technology. But there's a couple of other things about Airlace that I think are key. And if you're at a point that you're looking for a device, whether it's an Airlace device or it's something else, I think these are key points. You want the device to be diverse. Airlace has 30 indications, and they may even have more than that now. I was a little skeptical, and I probably do 27 of the 30 indications in my office. It's kind of crazy. The large majority, 90% of what I do with Airlace is cash pay, but it is a billable service depending on what you're treating. Some of the suppurative hidradenitis patients, I can bill that to insurance. I've had some genital warts that I've billed to insurance. So there are psoriasis, you can bill to insurance. Be careful, know your coding, know what is billable, but it is a device that you can both bill to insurance and charge the patient cash. Your tech, it's very user-friendly. It's not an exhausting procedure to do all day long, but it's also not exhausting to the patient. Like I said, it's very pleasurable, and the device is quite affordable. And last but not least, Airlace is a small device in a case that you can button up, put in your car, and take anywhere you want to. I have a satellite office that I go to 1 day a week, so I now bring the laser to that satellite area. You can host special events. You can participate in health fairs or shows, different things with this device that you certainly cannot do with another laser that might weigh, 600 pounds and you can barely roll across the room.
Yep.
So a lot of good reasons to look at Airlace if you're thinking of adding something new to the office.
Sounds good. I'm going to move on because we're coming to the end and I don't want to miss anything for everyone. So we're up to play 5. Communication, which is so important. Communicating to your current patients and prospective patients, as well as communicating to your staff. Why is this important? So you remain visible and relevant to patients who already know and like you. And there are many ways to do this. We'll talk a little bit about digital in closing. You want patients to know, A, what you've done about COVID to keep them safe and your staff safe. And, to me, I put it front and center. There should be something in the office, in every room. There should also be something posted on your landing page, on your website. Email is not dead. It's still a very effective strategy when done well, and you actually have information to share, not just self-promotion. And we'll get into social in a minute. So you want to have these consistent messages out there, and you have to determine, look at your open rate from eBlast. Are people opting out? That's kind of a dead giveaway that either you're bombarding them with too many emails or your emails aren't interesting enough. And that's the good thing about email communication, that it's very easy to track. You'll know exactly how you're doing with that. So that's an important part of having your practice ready to make profits, is communicating. So every time you bring in a new device or a new treatment, that's a reason for an announcement. And then there's the ongoing communications that are in and out of the office. So it's a constant battle of education. There's a balance between educating patients and selling to patients. And every practice is going to be different. I would just be careful not to send e-blasts that are all about discounting and special offers and this, that, and the other thing. It should also be about practice news. What's happening in the practice? Maybe you brought a new nurse in who's doing a specialized form of a treatment, or maybe you have a satellite office like Dr. Corbett just mentioned. That's news about the practice. And in my life, the way to communicate that today is going to be on social media. So let's talk a little bit about communication vehicles. Can we go to the next slide? So communication is key. Yes, we all agree on that. So I'm gonna tell you what my favorite channel is, and then I'm gonna ask Dr. Corbett what hers is. I really do think that in today's world, the most effective social media channel for aesthetic practice is without a doubt Instagram. It's kind of left Facebook in the dust. Facebook is very good for reaching an older population. The average Facebook user is somewhere in their 60s, if you can believe that. So it's not for younger people. If you've got a lot of acne patients, Facebook isn't the way to go. Instagram, I think, casts the widest net. And in my experience, I've seen practices do much better investing time and effort on Instagram. The challenge with these platforms, and this is important to know, if you're not seeing a lot of traction, it's not necessarily because your content isn't really interesting. It's because you're not boosting it or promoting it, because these platforms are advertising platforms. They're really not very different than Google. But all of the information we're talking about, like your experience with a new laser, before and after, all of these things is really good content and very directly related to your practice that patients are looking for on social media. Dr. Corbett, can you give us some advice as what's worked for you in terms of channels, and who does your social media in your practice? Because you sound like a very busy doctor.
So I am in the older generation, so I guess Facebook is still kind of my go-to, although
And that may reflect your patient population, and that's absolutely fine.
It does reflect my patient population.
Right.
I have an
I mean,
older
don't give up Facebook. Right.
Absolutely. But I'm fortunate that my staff and especially my esthetician are not older. And so they do a lot with our Instagram. And so
Great.
I actually have a company that does our website and our social media marketing. And so I outsource that. I will tell you, I did it myself for years, and
So much work.
You can't. If you are a practitioner, if you are not currently in the communication world, whatever that world is, you cannot do your own.
That's my world.
You can't. You don't know search engines. You don't know keywords. You're not getting the content. Our understanding of content is not necessarily what triggers your information getting moved around in that social media. I don't know any other way to say that. It's very layman terms, but
no, it's very true. It's overwhelming.
Spend it on, you know, your digital marketing, your social media marketing, and your website.
And that's a perfect segue.
Do what?
That's a perfect segue to play 6. Digital is defining engagement. That's 100% true all of the time. If you're not active on digital, you're invisible to a patient. And that includes being on Instagram in your practice name as a business, not necessarily personally. That's up to you, but it should be separate from your business. So let's talk for the last slide just about virtual open houses and events. So in a post-COVID world, events have become much more challenging to do live. However, I do believe that virtual open houses and events are taking off in every aspect of life today. And that doesn't mean you can't have a live event with 10 people or 15 people or whatever the regulations are in your community, but you should also augment them with virtual events. And there are lots of ways to do this. We don't have time to cover them all, but I'll just give you a couple of tips. One is, don't overlook something called Instagram Lives. They're really easy to do. You can do 30 minutes up to 60 minutes, and then Instagram cuts you off. I do them often, and patients they enjoy it. You could do it about one theme, like, I don't know, how to treat rosacea, and then talk about many things, or a new laser that you've brought in and what you're able to do with it, or it can be something even more seasonal. We're coming into the holidays, let's not forget that. So everybody wants to look good because they probably haven't seen their relatives in 6 months. And maybe they're going to have an actual Thanksgiving dinner. I hope so, for everyone's sake. Or they're going to spend some time at holidays with friends they haven't seen for a while. They want to look good. So here's your chance to get out there and in front of it. We talked about virtual consults, obviously, which I still think are a really important part of the market. I also like virtual events on Instagram as a giveaway. You can do it on Zoom. You can do it on any other digital platform. You can do it on Facebook. Facebook Lives have come back. They were kind of dead in the water for a while. If you're going to do consultations, they should be pre-booked, in my opinion, and there always should be some kind of a special offer only on the day of that event for someone who attended. If you want to extend it, that's up to you. I would make it imperative that they attend this event, because then you'll know that they're much more committed. And giveaways work really well on these channels. Raffles, giveaways, event-only special discounts, like attendees that come to the event will get a special fee, maybe on a package of, I don't know, non-surgical body shaping or something else you want to offer. So these are definitely strategies that should be part of what you're doing to maintain as well as attract new patients. Any closing remarks, Dr. Corbett, because we're just about out of time, and I'd love to hear what you're doing in your practice in terms of open houses, events, all of that.
We have looked into, we've done one or two kind of Facebook Live type things, and had some pretty good success with getting views and getting comments. How much of those have really turned into actual sales? I kind of question.
Okay.
We
That's
had
fair.
an event, but unfortunately, it just didn't, I didn't have the special sauce that you get from an in-person event. And so we're still trying to kind of figure out how to best do that.
Sure.
I think there's an interest in virtual events. I think people are more and more interested in attending them or catching them. But I think you just got to make sure that kind of that secret sauce, like you said, have some kind of raffle or drawing.
Oh, definitely.
For attending. We made some little bags, and so everybody that attended, we had their name on their bag, and they could come by and get their little swag bag or whatever, you know, when they could come pick it up and that kind of thing. And then
you can offer some kind of favor for, you know, inviting a friend, bringing a friend. Yeah. I mean, lots of things you can do. Skincare samples.
If you bring a person, you get an extra entry into whatever the drawing is. Yep. That works very well. But I do think, you know, looking at, I'm excited to hear about Instagram. I'm going to look into that because I think that would be but I do think we've got to have ways. You mentioned something when we first opened up about having an online access to your services and your products. That's something else that COVID did. Is when we were shut down, yes. I started an online part of our website so that you could pre-purchase your Botox. I sold a ton of Botox. People are sitting at home staring at themselves on the Zoom camera, and they're like, I have got to have some Botox. So make sure your services are accessible. You know, can people purchase online? Can they maybe get, you know, 10% off if, you know, purchase the month of October for breast cancer awareness or whatever. That has made a huge, huge difference in keeping the aesthetic revenue coming in when we were not actually seeing patients. And even now, women will still call and say, hey, can I pre-purchase, you know, some hair removal treatment? Yep. I'm not able to come in right now, but I want to take advantage of your special. And we're like, absolutely, go on the website, use the special code. And so I think that's very important.
Great. And I think especially, again, for this time of year, because we're coming into holiday season and now is when you can make your numbers. People are anxious, they want it. And, you know, I mean, there used to be a time when you might be offended if someone gave you a gift certificate to a cosmetic clinic, but now, gimme, 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 everybody wants it. It's the most coveted gift. So gift certificates can work. Just be really careful about the state that you practice in. In some states, gift certificates or gift cards have no expiration date, which means you have to honor them if you're still in business 10 years from now. So on that note, I'm going to turn it back to Sean.
Sure. So that being said, Wendy and Dr. Corbett, I really do appreciate your time and expertise. The closing statement I wanted to ask you guys, looking forward, what would you impart as one of the most important things to look at, you know, as we close out the year?
I think introspection of your business or practice, all the things that we kind of started out with, really knowing what your services are, what services are you not doing, or do you have things that you just kind of need to cut ties with, maybe repurpose or get rid of? Do you have areas that you're missing the mark and maybe you need to add a new treatment modality to your practice?
Yeah, I agree with that. I mean, I also think that you need to step up your social media because that's really where you need to be. And if you're not active on social and not doing it well, you're going to be invisible to a lot of patients that you really want to attract. So if you're not doing that, that should be kind of one of your 2021 resolutions. And I'd start now. Again, you've got to make this time count. I know everyone's had a really difficult year. We all have. But it's now or never. It's October to December is the time that you can really end the year in a positive note and with a number that you can live with. So now's the time.
Okay, thank you very much for that. And Wendy, excellent insights. Thank you for all the marketing advice. Dr. Corbett, thank you for all the clinical advice and imparting everything that you're doing in your practice to everyone else. Again, We appreciate all the help, and we will see you guys again shortly.
Have a great night. Great to meet you, Dr. Corbett.
Nice to meet you too. I enjoyed it.
Me too.